Hello everyone, welcome back to our Equine conference.
Hey guys.
Hi.
Today we will discuss a special case Gallop. Here we have the owner joining us today. Let's welcome Izzy.
Hey Izzy.
Good morning, everyone. 4 weeks ago, I got Gallop from the local sales. About 10 days ago, during a short morning ride, he collapsed on me and was down for about 10 minutes. My husband Tom helped me and noticed Gallop was yawning a lot and trembling. The next day, he seemed fine, but in the following days, I noticed him yawning more and his hindquarters twitching. He seemed energetic and happy, but I was still worried about him, and hence why I called Dr. Ish over for a visit.
Gallop is a 6-year-old mixed breed stallion. He was bright and alert upon assessment. His temperature was normal, but his heart rate and respiratory rate was slightly elevated. I noticed mild muscle fasciculations and the third eye lid prolapse. I ran some blood work and performed an electromyography, which showed mild myotonia.
Yeah, so the blood test results showed mildly elevated CK and AST, but more notably, his serum potassium was 20% above normal. Hematology also showed no signs of inflammation as well.
Mild enzyme elevation with hyperkalemia may suggest a functional neuromuscular disorder rather than inflammation. Likely possibilities could include HYPP, PSSM, ERS, or even ionophore toxicity. So I contacted Dr. Nev, our equine specialist, for further input.
So, from my understanding, Izzy has been feeding Gallop a high potassium diet, such as lucerne chaff, molasses grain mix, and pasture, which could potentially trigger HYPP. The third eyelid prolapse was a classic sign, so we decided to look further into it and run a muscle biopsy and perform the AQHA 5-panel genetic test.
So we were considering a genetic cause.
Yes, but we would not know until we reviewed the test results.
So with the muscle biopsy slides, we stained them with two stains, H&E and PAS, to review the muscle architecture. H&E stain slides showed normal muscle fibers, while PAS stain slides showed no excess glycogen. If there had been abnormal glycogen accumulation, it could be suggestive of PSSM. But in this case, both slides were clear. This means disorders such as inflammation, PSSM, and immune-mediated myositis were unlikely.
So this is why we wanted to look into the genetic sides of things.
Yeah, so we collected hair roots and ran the AQHA 5-panel test, which screens for 5 known genetic mutations, including HYPP. This panel serves as a preliminary screen to identify horses that may carry these mutations. To confirm HYPP specifically, we then performed PCR RFLP analysis. Basically, DNA was extracted from the hair and exon 23 was amplified, so we could assess whether there is presence of the mutation. This confirmatory test allows us to determine whether the horse is homozygote, heterozygote, or normal. Even horses that haven't had any episodes can be identified, so that's pretty crucial for management and breeding decisions.
So it's accurate, non-invasive, and definitive. Sounds ideal for confirming HYPP before symptoms appear.
Yeah, exactly. And if needed, we can also confirm with DNA sequencing. But for known mutations like this, PCR RFLP is faster and more cost-effective. It doesn't require blood, as hair sample works just as fine.
Makes sense. This helps catch asymptomatic carriers too, right?
Exactly. It gives us a clear genotype for the horses affected.
But there's also an important limitation that we need to consider, as this test only detects this specific mutation. If a horse has similar symptoms to another condition, this test will be negative.
Yeah, and it doesn't tell us the severity, right?
Yes, some horses with the mutation may never show signs, as the test cannot predict the severity or frequency of episodes.
Plus, the test's accuracy actually depends on the sample quality, so if the hair or DNA is poorly collected or contaminated, it could give us false results as well.
So overall, genetic testing for HYPP is a valuable tool. It helps us make early informed decisions, but it should also always be interpreted in the context of the whole horse.
Thanks for explaining the testing, but sorry if this is a basic question. What exactly is HYPP?
Yeah, so HYPP, hyperkalemic periodic paralysis, is an inherited disorder caused by a single nucleotide polymorphism in exon 23 of the SCN4A gene. This means there is a single base substitution of a C to G transversion. Yeah, so basically Gallop was born with this mutation, unfortunately. So SCN4A is a sodium channel gene in the muscle, and in affected horses, this point mutation in the sodium channel gene can be passed on to offspring. The type of mutation caused by the single base substitution is classified as a missense mutation, where the SCN4A produces an altered alpha subunit in the sodium channel. This change leads to changes in the codon and results in a defective protein that disrupt normal muscle excitability. In other words, think of it as a typo in the horse's gene. This typo affects the protein in the muscle called a sodium channel, which is like a gate that receives signals for muscle movements. With this typo, the gate will not work properly and leads to an activation of the muscle at the wrong time, which is why we're seeing signs of trembling, muscle twitching, and temporary weaknesses in Gallop.
I see now. So how did Gallop get this?
So HYPP actually originated from a stallion named Impressive, and a heavily muscled quarter horse known for his desirable conformation, which made him a popular sire. Due to extensive line breeding and crossbreeding, the HYPP gene has since spread beyond the quarter horse breed. Because Gallop is a mixed breed, it's possible he inherited this mutation. As mentioned earlier, HYPP is caused by a mutation in the SCN4A gene. Each foal inherits 2 copies of this gene, one from each parent. Since HYPP follows an autosomal dominant pattern of inheritance, only 1 copy of the mutated gene is needed to cause the condition, and it can affect both males and females equally.
How come the episodes came on so suddenly?
Some affected horses may never show episodes, while others develop them later, usually around 2 to 3 years old. Since Gallop is positive for HYPP, he is at risk of lifelong episodes, often triggered by stress or elevated potassium levels.
How can I prevent triggering these episodes?
You need to change his diet, replace lucerne chaff and molasses with a medium to low potassium diet such as grass to help lower blood potassium levels and reduce episode risk.
But what about exercise? I do enjoy our morning rides.
Keep him on regular light activity rather than resting immediately after exercise. Make sure he cools down properly because abrupt rest can lead to sustained elevations in extracellular potassium, increasing the risk of an episode. Monitor him closely and adjust as needed.
Okay, but what about breeding? He's such a gorgeous boy with a muscular build. I would really love to breed him.
I would strongly advise not to breed Gallop. While we can manage HYPP and reduce the frequency of episodes, long term these episodes can become fatal. As mentioned earlier, only 1 copy of the mutation is needed to affect a horse.
Just to help you understand a little bit better, if Gallop is heterozygote for HYPP and carrying 1 mutated copy, breeding him with a normal horse would result in a 50% chance of offspring being affected. If he were homozygote, meaning both copies carry the mutation, breeding him with a normal horse would result in 100% affected offspring. And that's pretty severe and potentially fatal as well.
There is actually a rule in the American Quarter Horse Association regarding HYPP. Even though Gallop is a mixed breed horse and is not part of the registry, the same breeding advice applies. There is a rule that bans homozygote HYPP foals from registration, but genetically, the risk of passing the genetic disorder is the same for all horses. Horses potentially related to Impressive, like Gallop, should always be genetically tested before breeding or purchased to prevent unintentional spread of HYPP. Understanding the genotype and phenotype helps assess risk and severity, even in the horses that appear healthy. So please spread awareness in the breeding community. Only healthy horses should be bred.
That is a bit disappointing, but thank you so much for your advice. I will definitely follow your recommendations.
That's the best plan. With careful management, Gallop can live a happy life. Regular monitoring, low potassium feeding, and appropriate exercise are key. And keep a record of any mild episodes, even small signs like yawning, muscle fasciculations, or mild weaknesses can help us adjust management before a severe attack occurs.
On a brighter note, by understanding Gallop's genotype and monitoring triggers, we can reduce risk and improve his quality of life.
Thank you for sharing Gallop's story with us, Izzy.
Thank you all for your advice. I feel much more confident in managing Gallop now, and I'll make sure to share what I've learned with other horse owners.
That concludes our case discussion on Gallop. Let's all keep in mind the importance of genetic testing and proactive management. Have a great day, everyone.
Thank you
Thank you.
guys. Bye.
Thank you.